and welcome to Askimo TV. We're talking today to Dr. Kulvinder Lall. Dr. Lall is a UK leading heart surgeon. Hi, Dr. Lall, how are you?
Good morning.
Dr. Lall, today we're going to be talking about minimally invasive cardiac surgery. So, for which conditions would minimally invasive cardiac surgery be ideal, and who are ideal candidates?
Okay. There are some types of cardiac operation that lend themselves towards minimal access surgery. Minimal access surgery is anywhere that you don't have to do a full sternotomy, which means opening the chest fully. So in our practice, we perform only valvular surgery through minimal access surgery. So we can do aortic valve surgery through a small incision in the upper part of the sternum, which is about 4 to 5 centimeters. And we can also perform mitral valve surgery through a small incision in the side of the chest called a mini thoracotomy. These incisions are about 5 centimeters long, and they do cause less pain and less suffering for the patients after the operation. In addition, if you have coronary artery disease, and but only in one vessel, in the left anterior descending, we can also perform coronary artery surgery on a single vessel off pump through a small lateral mini thoracotomy in the side of the chest. So those are the three main indications for minimal access surgery.
And who would be ideal candidates for this type of surgery?
Okay, so with the valve surgery, if we take it in steps, for mitral valve surgery, patients who are thin and tall, generally men make better candidates because they have less tissue around on the chest to gain access into the chest. And those patients who are having mitral valve repairs, I think if you're having a mitral valve replacement where the valve is very calcified and rheumatic, then a standard sternotomy is probably better for you. For aortic valve surgery, virtually anyone who has been referred for aortic valve surgery can have an upper J incision for the aortic valve surgery. And again, for coronary artery surgery, ideal candidates are, again, thin patients who have single vessel LAD disease.
What are the benefits to minimally invasive cardiac surgery, and why is it called this?
Okay, so the benefits are multifold. One is that the incision is much less, so cosmetically for the patients, the incision is much less disfiguring. Secondly, because it is a smaller incision, it's actually less painful after the operation. And thirdly, because there's less trauma involved in the operation, the patients are much more likely to go home much earlier. So, for example, after an aortic valve operation, they could go home at 3 days after the operation, whereas the normal length of stay is probably about a week or so for the operation. And again, the ideal sort of patients are, thin patients who don't have much in the way of tissue on their chest.
And what are the risks, if any, to this type of surgery?
Generally, if you select your surgeon, the surgeons who specialize in minimally access surgery, their complications are no greater than patients undergoing conventional full sternotomy surgery. So the risks are much less.
And how will a person feel after surgery? What are some of the things that they should do and not do post-op?
Okay, so post-operatively, they will have smaller incisions and they will have less pain, but they still need to carry on with the physiotherapy, the gentle walking, and also getting back to their normal activity. So the post-operative recovery is pretty much the same as patients having a full sternotomy.
Thank you, Dr. Lall. Thank you so much for talking to me today.
That's a pleasure.